Hello, my name's Dr. Philip Memoli. I've been practicing holistic dentistry for 30 years. I'm going to have a discussion today on safe amalgam removal, the operative word being safe. I've taught safe amalgam removal to hundreds of dentists in the Institute for Natural Dentistry and Systemic Dentistry, and today I want to have a discussion about what safe amalgam removal actually constitutes. So when we say safe, there are actually three major risks involved in amalgam removal. The first, which everyone acknowledges, is the vapor. When you're grinding mercury out of the tooth, it produces mercury vapor. And the mercury vapor, 80% of this gets absorbed into your lungs, and before the body can oxidize it, it gets into the brain. And once it gets into the brain, it's hard for the body to get out. There is a 23 to 25 year half-life. So a lot of this mercury gets trapped in your brain. So before you consider taking the mercury out, you have to make sure that you don't get any mercury into your brain. And any good trained holistic dentist can accomplish this. There's protocols for this. There is the rubber dam, there is oxygen. These protocols are pretty set, and most trained holistic dentists are very good at this. The other two major risks, one is tooth sensitivity or tooth loss. You don't want to have mercury removed and then have a constantly sensitive tooth or a tooth that has to be extracted or a root canal be performed. Now, what constitutes a risk? Well, a lot of these amalgam fillings are placed without any protective bases being placed. The protective base is there to protect the nerve of the tooth. 99.9% of amalgam restorations don't have any base in. So as a result, a lot of these dental nerves, some can be normal, but the majority of them are either inflamed or they're in degeneration. So for those that are inflamed, you're risking tooth sensitivity after we drill out the filling. For the ones that are degenerated, you're risking that tooth dying. Okay, so and this is something that has to be diagnosed before. The dentist in his exam before this gets started has to assess the health of each nerve, and once that is determined, those nerves have to be treated before the amalgam removal is done. So once these teeth are back to normal, amalgam removal can proceed. The other issue is detoxification. Now, detoxification is important because once amalgam is removed from your mouth, your cells begin to release mercury, and that mercury is released into your blood. How does the body process this? It has a system called the detoxification system. Now, the detoxification system is being intently studied, particularly in cancer research, and a lot of this is under this new form called personalized medicine. Because in personalized medicine, we want to find out how your immune system is different from everyone else's and how your detoxification system is different from everybody else's. So these are the two parts of the body that are the most significant for keeping you healthy and preventing disease. Both of them are highly variable. All right? Now, in some studies that were done, there was a study done in Iraq where we charted people's detoxification potentials. And basically what they found is roughly about 75, 76, 78% of the population could be classified as a fast detoxifier or a slow detoxifier. And that came out as a bell-shaped curve. Well, when we followed the bell-shaped curve further, there was another smaller curve, and that curve are poor detoxifiers. So apparently it was understood or misunderstood that maybe 1% of the population were poor detoxifiers. But what we really discovered in this study was that 12% of the population are actually poor detoxifiers. And for those who do research, you can find this under Clarkson. But at any rate, if you're one of these people who are a poor detoxifier, and that could be 1 out of 9 people, all right, You may have symptoms of multiple chemical sensitivity. You may have a chronic degenerative disease. You may have symptoms that nobody can place a label on, or you might be perfectly healthy. A lot of these perfectly healthy people go into procedures like this, or medical procedures, and come out with results that other people just don't have. They crash after a medical or dental procedure. Okay, these are the 12% who are the poor detoxifiers. All right, so in essence, you want us to assess whether you're a poor detoxifier or not. And this has to be determined before, because once you have this procedure done, it's too late to go back. So, to sum everything up, all right, a dental exam should be performed before. This is a process. This is not a step. This is not, hi, Mrs. Jones, oh, you want some amalgam fillings taken out? Come in and we'll take care of them. This is a process. There's steps here. Your risk factors have to be assessed before at this exam, and they have to be treated before this process is done. Otherwise, you're risking a loss of maybe tooth health, tooth comfort, and maybe even systemic health. All right, so again, my name's Dr. Philip Memoli. Thank you for tuning in. Have a great day. Thank you.